Welcome to Live with Hillsdale Hospital. Today is Wednesday, July 9th, and we're here to keep you, our patients, our families, and our friends up to date on what's happening in healthcare right here in Hillsdale County. I'm your host, JJ Hodshire, President and Chief Executive Officer, and we're so excited that you have joined us today because I have a very special guest with me. I would have to venture to say that this is the first time that you've been on a live event like this. Has it been the second?
Yes.
And how many years have you worked here at Hillsdale Hospital, Trish?
29.
So 2 times in 29 years tells you that she pushes back quite a bit. So first, Trish, it is great to have you here in the studio. I often tell people that your job is like a mini CEO of a hospital because it's exactly what you do. We're going to talk about your role as the administrator, chief nursing officer, director of nursing, director of all things for our skilled nursing facility. But first of all, for our listeners, give a little background of yourself. I mean, you went to nursing school, obviously. Talk a little bit about that, maybe your education, how long you've been at Hillsdale.
Okay. I went to nursing school many years ago, got my RN, was a nurse on the floor for our skilled nursing facility here, maybe a year and a half. Became the director of nursing, went to school to get my bachelor's degree, went to school to get my master's, got my administrator's license, and did some wound care training and amongst all of that. So I've been here 29 years with our skilled nursing facility, McGuire and McRitchie, for a long time.
So let me go back. I didn't realize this was your first job in nursing?
My first job was in Spring Arbor
for Spring Arbor.
6 months.
So you did the same thing?
Yes.
So 6 months there, come to Hillsdale. Now, why Hillsdale? Are you from this area, or is that?
I am from the area, but to be quite honest with you, I didn't know there was a hospital here.
Is that right?
Yes, I did not know that, and it was a friend that worked here that mentioned something about the facility, a new facility opening up, and
right.
I applied.
So I guess I didn't know the course of action that you've taken throughout your career in terms of management, but you were here a year and a half and then became a director.
Yes.
Wow.
So not much time on the floor.
Yeah, but still, so 26 years then?
At least, yes.
26 years. You've seen a lot.
Seen a lot.
Been through a lot.
Been through a lot.
Let's talk about when you arrived here, your original tenure. We just had one unit, right?
Yes.
Talk a little bit about how it's, really morphed into something much bigger and greater.
When we first started, we were a 21-bed unit. It was a combination of long-term care and skilled rehab. And we did that for about until 2013. We decided to expand. We expanded into 2 units. So we now have 19-bed unit, McGuire unit, which is our skilled nursing facility where we do rehab, IV antibiotics, there to recover from surgeries and any illness that you may get. And then we have our 19-bed long-term care unit, which is called McRitchie. And that is strictly long-term care over there. We do have some hospice, we have some respite over there. And also like that with our skilled nursing facility, we also do respite care on that facility.
So someone who may be tuned in, what does respite care mean?
Respite care is if we have a family in the community that needs a break from taking care of their loved one.
Okay.
So if they need a break, there's a few different ways to be able to accomplish how you pay for it. You can pay for it privately.
Mm-hmm.
You can, if you're through hospice, they help arrange it to set up a respite stay.
Okay.
And it's paid by the hospice through that.
Okay.
And there's some other things with insurances that may cover it.
But let's talk about respite care. That really depends on if you have the beds open, though, right? Or
Correct.
no?
Correct.
Okay, so you have to have the beds available to do it.
Correct.
So let's talk about how does someone gain access to either unit. Let's first start with your rehab. So rehab is going to be more short term, right?
Correct.
What is average length of stay, would you say? How many days would people normally stay in rehab?
Normally, we average about 15 15 to 18 days.
Okay, so
normally.
15 to 18 for rehab.
Yes, it varies, but that's normal. Some people are here for only a week.
Okay.
Some people are here longer.
Longer, depending on what their
Yes.
recovery. So during that period, let's tackle rehab first. During that period that they're here, services come right to them, right?
Correct.
Let's talk about some of that relationship because they never have to leave the unit
Correct.
to get those services. We actually bring them to them. Talk about that.
That is one of the best things about our facility, because being part of the hospital, we are able to we have radiology here, we have our lab here, we have physicians, surgeons. Like if something's going wrong, we have immediate access to things. We don't have to wait for somebody to drive up to your facility to get an x-ray done.
Or transport that person from that facility, like happens in various communities, to the hospital. They come up on the floor.
Correct.
Which is absolutely amazing when you consider the patient can just stay right there, the resident, in their environment. Correct. And speaking of the environment, for skilled nursing facilities, some folks are here for years. I mean,
for long-term
care. Yeah, I'm sorry, for the long-term care section.
Mm-hmm.
And they're here for years. Looks a little different on that floor, right, compared to your rehab center?
Correct.
Talk about the difference between that then.
Probably one of the biggest differences is that most of the residents on the long-term care side go to the dining room. So you always see the residents in the dining room with each other talking.
Yeah.
They
Puzzles,
have
church, whatever it is.
They have tons of activities going on, or they're sitting out on the patio because we have a great patio now.
Yeah.
So there's a lot more interaction going on a long-term care unit.
Shout out to your activities coordinator. I mean, my goodness, she does a great job.
She does.
I'm always hearing about programs and things they're doing and activities. And that's important. Activities are important for integration. You know, whether they're here for very long term, which I think, didn't you tell me at once that the average length of stay is 30 days on that unit? Or is it extended?
Are you talking short stay or long stay?
Long stay.
Oh, that's years.
But I'm saying the average, though, someone could be here for a month or 2 months. It just depends on insurance.
Long-term's different.
Okay.
Long-term is covered mainly by Medicaid or private pay.
Okay.
So that's totally different.
Right.
The private pay usually turn into a Medicaid stay.
Because they spend down
all the money.
Yeah.
Yep.
So let's talk about how someone gains access into these units, right? Because we have historically had issues where the unit's full. And so you've had a waiting list before.
Correct.
And that is not always the best position for the community. It means it's good for the hospital because, you're filling those beds. But at the end of the day, if someone just wanted to be part of the skilled nursing facility, they can't just say one day, I want to do it, right? There's got to be a process.
Right.
Talk to us about what that process is. When does insurance kick in? When don't they kick in? How does all that work?
Well, it's confusing, but...
and that's why we have you here.
Yeah. Usually, how it normally works is that we receive a referral from a hospital.
Okay.
Because they've been looked at and determined that they need a longer stay, either getting therapy, IVs, or other medications to help them get better, to be able to do better at home.
Yeah.
So we get a referral. We have to take a look at their insurance to make sure their insurance will pay for their stay with us.
And that's a big battle for you. You have staff dedicated just to dealing with that.
Right.
Because we get a lot of denials.
Correct. It's a huge battle just because there's so many managed Medicare right now that everyone does something different. So they're all different.
Every insurance payer does something totally different.
Yep, they do something totally different. So we have to know their rules and get things approved before they can come. And sometimes they're sitting in the hospital waiting for those approvals, unfortunately, when they could be with us right away.
Yeah.
So we do take people directly from the ER, but it depends on your insurance.
Yeah.
And we do have to wait for the prior auth to get approved to bring you up.
So that could be days.
It could be. We did have somebody that had to sit in the ER for a few days until it got approved
Yeah.
for them to come
But
up.
that's not a Hillsdale problem.
Correct.
That's an insurance problem.
Yes.
Because they typically don't like to pay.
Correct.
So let's talk about that, because the biggest complaint I get from the public, I get the text, and then I'm texting you,
Mhm.
is my ex, father, mother, husband, they have to go home tomorrow. We want them to stay longer. But you find that this is all regulated by the insurance companies.
It's all right. Yes. They determine with us by looking at, they get the patient's information, and they take a look at what we send them, and they say we have to cut them. So then we have to cut them. The patient does have the ability to
Appeal that,
appeal
right?
it, yes. And sometimes it works, sometimes it doesn't.
Yeah.
Which I would suggest appealing.
Appeal. So Trish, what is the timeline then? So if you have to tell them they're going to be dismissed and they're going to be discharged, do they stay until the appeal's done? Or
Correct.
Oh, they can.
do, yes.
So they file that appeal. How long does an appeal usually take?
Oh, it varies with the insurance company.
Could be hours, days, or
Correct.
Yeah. And then during that period, though, we don't discharge them
Correct.
until they lose their appeal.
Correct.
What happens during the phase between the appeal and then the determination on the end? Is that state covered?
It is. If they lose the appeal, then they have to pay.
They have to pay for it.
Correct.
So that's a risk they take by appealing
Correct.
it, is because they'd have to pay it. And skilled facilities throughout this country, we're fighting insurance companies, but there is always an option that if they don't meet the medical qualifications for that long-term care, that private pay is an option.
Correct.
Now, private pay, we have a little different policy on private pay.
Mm-hmm.
We're able to offset that a little bit with a discount.
Yes.
And so is that paid on a monthly basis, a weekly basis? How is that paid?
A monthly basis.
A monthly basis.
Yes.
And then if you have a bed, they make their application,
Mm-hmm.
you accept that, then the family, whoever it is, makes a monthly check out to the hospital, correct? For the
Correct. And if they end up not staying the entire month, if we go with that, we reimburse them for what they didn't stay.
Okay. So, the quality of life in the hospital, and in a residential, non-residential setting like this, where it's more therapeutic in nature or medical in nature, it can feel, institutionalized.
Mm-hmm.
But what you've done is you've kind of created little homes in those areas, and we call them residents, right? And that's important because they are a resident of that facility. But what types of things do you do to make it a home? I mean, I think you bring in services like get your hair done.
Yes.
And get your nails done, maybe. I don't know.
Yep.
Talk a little bit about that to our listeners.
We do have somebody that comes, and actually it's one of our CNA's nursing assistants that comes in and does the residents' hair. They get their nails done all the time. We bring in a lot of different things to try to make it feel like their home. They're able to bring in things from their home to their rooms for a long-term care stay. Residents, a lot of them have their own recliners.
Okay. They have to be checked in, obviously.
They have to be checked in, yeah.
Good working condition, and those things, right?
Correct. I mean, it's still not your home,
It is.
but we try to make it as good as possible.
It is, and I have to commend your staff. We've had many family members, as you know, personally, on your unit, and the staff are phenomenal. They do a great job. They love on their patients.
Mm-hmm.
They care about their patients.
They do.
It's not just another person in a room. They begin to build a relationship with them.
They do.
And a bond, which is very important. So how does, let's just say, I'm thinking about, we need to find a place for mom. The insurance will not cover it because it's not medically necessary, so we're going to pay for it. Does that payment monthly get all services for that particular unit, or is there an a la carte? Do I have to pay for other things?
No.
So it's all paid for and encompassed in one price?
Yes,
with let's just say long-term care.
Yeah, that's kind of a difficult question,
right?
Because there are some things like different supplies.
Okay.
There's certain supplies
All right.
that we have to
Okay.
provide,
Right.
and there's certain supplies that we have to charge
We have
for.
to charge for, right?
So,
All things equal,
yeah,
there's going to be a monthly cost, not a whole lot beyond that,
Correct.
beyond the monthly. Depends on the acuity of the patient,
correct.
right? And what their needs are. Now, the types of patients that you can accept, we've often heard patients that need dialysis. Is that an option for us?
It is and it isn't.
Right. Well, let's talk about that because I often get that question. We don't manage it here.
Right. We do not manage it here. It depends on how stable the patient is, because sometimes they're not always the most stable when they're on dialysis. And then the big thing is transportation. That's our huge thing because it's so much transportation back and forth.
Yeah.
We don't have a driver dedicated to take someone back and forth. So that's the huge issue with us.
Right. And they could be at the dialysis center for hours.
Correct.
And then to tie that staff up. And so that becomes a challenge for us. But you have accepted dialysis patients before.
We have, yes.
I do know that. And that's helped a lot of families, keep their loved ones locally. So a lot of great things that are happening, Trish, on both of your units. They're both beautifully decorated, very nice. You've done a tremendous amount of great things. And I want to thank you for that, the work that you've done. The key is that, if you're listening today and you're thinking about, what, physician is making the recommendation, you have choices. You can say, what, send it over to Hillsdale Hospital, skilled nursing facility. We will take a referral. There's staff that always will be available to take that referral. They will run your insurance to make sure it's authorized, and then you're transported here. In some cases, patients are transported, let's say, from maybe it's a Jackson hospital or another hospital. Right. They're brought here by ambulance or courier service, and we receive them, and then we take care of them for however long is necessary to increase and improve the quality of their life, and that's the key. A lot of folks you're able on the rehab side to get back active in their lives again. And when we think about rehab, don't think it's just for 80-year-olds.
Correct.
I mean,
it's not.
Talk about that. I mean,
we have a 36-year-old right now. So
yeah. So it's not just 80-year-olds.
We get a lot of 50-year-olds. So
that pains me.
I know
to hear
it pains
that.
Me too.
51, Trish. My goodness. Well, let's hope there's not a whole lot of those. But at the end of the day, the understanding is that it doesn't matter the age.
Correct.
It's a service that we can provide here. And that is critically important. The bolt-on or add-on services that we offer is that in the convenience of this facility is you get PTOT services. You'll have radiology coming up, phlebotomy. And in many of these situations, if you go to another type of residential, you're going to end up having to go outside for those services. Right. And so that's a challenge. Last thing I want to ask you is something that exciting that happened a few years ago is we launched a new safety measure, which was hand washing.
Oh, yes.
We're like the first, skilled nursing home in the country. Or is it? Definitely the state.
Definitely the state.
That has this technology.
Correct.
What is it? Why is it important? How are we using it?
It's called BioVigil, and it's a little badge that we wear, which I don't have on, but it's a little badge that we wear that each staff member gets clocked in, assigned to their badge, and when they go in and out of rooms, it's kind of neat. It sniffs. It sniffs their hands. They have to cup their hand over the badge after they hand sanitize or wash their hands. And it detects whether they have hand sanitizer on their hands, and it clocks them in as washing in and out.
Which is an important measure.
It is.
With sick patients to make sure that the staff are scrubbing in, scrubbing out of that room because we spread, obviously, illness, disease.
Yep.
And so it's very, very important that they do that. Now, what do you do so you have them wear their badges. What happens if they're not washing their hands?
We get reports, which is fantastic. We get reports of each individual staff member, and we get reports for each unit saying how well they're doing. They generally do very well. We do have an occasional staff member that we have to talk to to get them to do it better. Sometimes they forget going in and out. And if we see them with a red on their badge, we know that
Because
they
it alerts
forgot.
it. Yeah.
Yes, we know that they forgot to
Yeah.
cup their hand over it.
Yeah.
Or
They may have washed it and they just didn't cup it to.
correct, which
determine.
that's
Yeah.
usually what happens most of the time.
Well, the goal is to, prevent or slow down the spread,
Yes.
especially from one room to the other, as you have sick patients on the unit. And lastly, as we look at integrating individuals back into their normal lives, when a patient is discharged from the hospital, there are other services that we can offer as well.
Mhm.
Like we have home care.
Home care.
And
Yes.
do you find that you have a relationship with some of those other partners in the hospital?
Yeah, we have a very good relationship. Two particular home cares,
Yeah.
Hillsdale Home Care and Alara, very good relationship with them. Most people go with Hillsdale, and
We like to hear that.
but they provide the nursing services and then continue on with therapy if needed.
And the great news is now that we have a new durable medical equipment, which is now down at the old movie theater or at the movie theater, right in front of it, we now have medical supply company.
Yes.
So if individuals are discharged that need medical supplies,
Correct.
we can provide that as well. So it's home care. We have outpatient PT, OT.
Yes.
So if they need rehab, because you do find that to be the case, right?
Yes.
They have that continuation of care beyond just inpatient.
Almost always. Yeah.
Always. So we build now when they discharge, is your staff, your discharge staff, working them through that to say there's the services and there's the service. That's another add-on that we do.
Yeah.
All right, Trish. If someone wanted to talk to admissions, how do they get a hold of them?
If it's an individual person, then they need to call Courtney, which is my admissions discharge person.
Okay, we'll put the number up on the screen.
Okay.
Because it's 437-5233, maybe?
Yes.
Something like that. Yeah, thank you. Yes, thank you. I have it right there. So that's why I do it. So they can get a hold of her.
Yes.
And have conversation. What if it's a physician referral?
A physician referral generally will go through the referral process. We have this fancy system that's called CarePort, I believe.
Yeah.
And that's where all of our referrals come through there. Unless you're a hospital that does not have this CarePort, then they generally fax us.
Okay. So talk to your primary care physician. If they're talking to you about extended care that you need to get you back into integrating into your normal activities, and you need a short period of time, contact us. Talk to your physician about Hillsdale Hospital and what services they have right here in your backyard. Beautiful, beautiful rooms, beautiful day areas. You can go outside now. I see our umbrellas are set up. It's food is great. I often get a lot of compliments about our food, Trish, and it's not just institutional. It's very good food. If you're looking to volunteer, this is a great unit to volunteer. We need folks coming in that can read to our residents. We want folks that come in that can minister to our residents. Plenty of opportunity for volunteerism that exists in that area as well. So I want to congratulate you and your team for the great job you do each and every day to make sure that our patients and residents are well cared for. So thank you, Trish. Are there any questions from our audience? You've done such a fantastic job that no one has a question. So please note you can reach out to us, and if you're maybe a son or a daughter, relative that's looking for some respite care, you just need a break, because it is very challenging. We've both been there. It's very challenging to care for a loved one, and especially if you move them into your home and you need to get away for a period of time, maybe a family trip or maybe it's just a day trip. There's options available for you under respite care right here at Hillsdale Hospital. And the beauty is you get access to all of the care professionals that are in our hospital. That is the difference between us and, let's say, maybe a competitor who's not hospital-based. So reach out to us, 517-437-5233. It'll appear on the screen. And if you want to speak to the Skilled Nursing Facility Administrator and Director of Nursing, right here she is, Trish Masarik. It's been great to have you on the program today. We want to thank you, our listener, our community, for your support. Your continued support means so much to us. We cannot do what we do every day without you utilizing our services. You are what creates the environment that we have today. And speaking of that environment, plenty of opportunities for you to join a winning team. We have many, many job openings. I understand close to maybe 40 now. that are across the spectrum of responsibilities, education levels, entry level. If this is something you want to consider, go to our website, hillsdalehospital.com. Under the careers tab, it lists all of the job openings that are available. This is a great segue. Trish talked about how she came here, and within the first year and a half, she's running a very successful unit. It may not always happen that quick, but you will have opportunities when you hire in here. We've placed many individuals, and you've watched this in your career, Trish, who started admitting, who are now directors of nursing units.
Yes.
Because we want to invest in our staff. So if you're looking for a place that will invest in you, it's right here at Hillsdale Hospital. Plenty of job openings and opportunities for you to find your new passion and a new career that you could walk into and then progress in education and training. So check us out on the website. Also, if you're looking to volunteer or make contributions, you can also go to our website, hillsdalehospital.com, to find out how to do both of those things. Each week, we provide this information to keep you up to date, our listener and our friends. And we would just encourage you to continue to listen to us on Buzz 102.5, WCSR 92.1. But please tune into our national podcast, Rural Health Today. Wherever you get your podcast, download Rural Health Today, and you can learn about what's happening across the country. There's been a lot of things happening across the country, Trish.
A whole lot.
Yes, and so we're talking about it because it's important to have a dialogue and not to bury our heads and say, well, we have to move on. We do have to move on, but how are we going to do that in today's new environment? So we're addressing and tackling those issues on our podcast. I'm excited to announce this week that our speaker is actually the American Hospital Association President and Chief Executive Officer, Rick Pollock, who I've had a chance to get to know. And you will find his presentation encouraging. It's remarkable. It explains a lot of the dynamics that are happening in Washington, D.C. right now and how we got where we are today with some of the legislation. So tune in wherever you get your podcast, and we will see you back here next week. But until then, stay safe, stay healthy, and stay Hillsdale strong when you choose Hillsdale first. Thanks for joining us today.